Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Abdullah. May I know what brings you here today? Okay. Tell me more. I'm really sorry to hear about it, Mr. Abdullah, and I understand your condition, how painful it would be for you. Mr. Abdullah, in order to reach my diagnosis, I need to ask you a few questions. But as you are in severe pain, may I offer you some painkiller before we please proceed? Are you sure, Mr. Abdullah? All right, Mr. Abdullah. So, can you tell me since when you are experiencing this pain? Okay. And what were you doing at that time? Okay. And can you tell me the onset, if it was sudden or gradual? Okay. And can you tell me the duration? Okay. And how about his progression? Okay. Can you tell me about the pain? Yes. Okay, Mr. Abdullah. So if it goes anywhere else? Okay. And if it is constant or comes and goes? Okay. Where is the pain exactly? Can you locate? All right, Mr. Abdullah. Besides that, do you have a pain anywhere else? Okay. And if there is any nausea, vomiting? Okay. What do you think? What aggravates your pain? Okay. And what relieves? Okay. If you have taken any medication so far? All right, Mr. Abdullah. Do you have diarrhea, constipation? Okay. If flatus is passing? Okay. And do you have urinary frequency? All right, Mr. Abdullah. So I'd like to examine you. Is it okay with you, Mr. Abdullah? Thanks for your cooperation, Mr. Abdullah. So, Mr. Abdullah, I'll be pressing your lower tummy, okay, at a certain point, okay? And you have to tell me whether you feel more pain or pressing your tummy or on a sudden release of my hand, okay? And if you feel more pain, I'll stop there and then, okay? If it makes sense to you, Mr. Abdullah. All right, Mr. Abdullah. So I'll be palpating and okay, first of all, I'll sanitize my hands, and then I'll expose his shirts after taking permission, and then I'll inspect if there is any scar bulging or any abdominal distension, if there is any asymmetry, and then I'll start from the examination. So I'll palpate at left iliac fossa, and by palpating left iliac fossa, I'll be looking at patient's face, and if he's experiencing any pain. If he experiences pain, that means arousing sign is positive. And then I'll palpate at McBurney point between umbilicus and right iliac spine, and if pain is selected by pressure, that means McBurney's sign is positive. And then I'll ask patient, okay, Mr. Abdullah, I'll be pushing down your right leg, okay, but you have to raise your leg against the resistance, if it makes sense to you, Mr. Abdullah. Okay, so while pushing down his leg, if a patient experiences pain while flexing his hip, relax that sign is positive, the patient will feel pain in right lower quadrant. And in the last, I'll be checking obturator sign by flexing the right hip and knee, and then I'll pull patient leg laterally while maintaining knee position, and while internal rotation of hip, if patient feels pain, that means obturator sign is positive. And then I'll check patient pulse and eyes and edema. Okay, all right. Thank you for your cooperation, Mr. Abdullah. And then again, I'll sanitize my hands. Okay, Mr. Abdullah, I'll offer you following investigations. Okay. But Mr. Abdullah, first let me inform you that the information you have shared with me about your symptoms, and on examination clinically it appears as most likely you are having a condition what we call in a medical terminology is appendicitis. Okay. Yes, Mr. Abdullah. So for that, I'll be referring you to a general surgery emergency right away. Okay. If it makes sense to you, Mr. Abdullah. Yes, Mr. Abdullah. Can you tell me if I can inform your family or if someone is accompanying you today? All right, Mr. Abdullah, you need not to be worried, okay? And just lie down, okay? And I'll call ambulance for you, okay? And besides that, I'll call your family as well, okay? And you need not to be worried, emergency department is only 20 minutes away, okay? And I'm not going to give you any painkiller, okay? As this will mark this sign and symptoms of, appendicitis for doctor who will examine you, okay, Mr. Abdullah? Yes, Mr. Abdullah. So besides that, I'll offer to establish your RV line, okay, and I'll offer to take some blood samples, okay, till ambulance arrives and your family members arrives, okay, and this will save time in emergency, okay. So I'll take sample for blood test, okay, CBC and urine DR, okay. Yes, Mr. Abdullah, you need not to be worried. I'll give a written record, okay, and you have to give at surgery, okay. Yes, Mr. Abdullah, and it's surgery. If you need surgery, it will be done as soon as possible, but you may need to wait a few hours, okay? And operation usually takes 1 hour, okay? And you will be given anesthesia, so you will be, not able to feel pain or anything, okay? You will be asleep, okay? Yes, Mr. Abdullah, actually, if inflamed appendix burst or perforates, then the whole abdomen will be infected, okay, and then the treatment will be quite complicated, okay, if it makes sense to you, Mr. Abdullah. Yes, Mr. Abdullah, sometimes it's possible to treat appendicitis with antibiotics rather surgery, okay, and this may be recommended if the infection has not spread, okay, and surgery is high risk for you or not, okay, and so that's attending a surgeon in emergency will decide that, okay. Is everything clear till now, Mr. Abdullah? Okay, so Mr. Abdullah, I'll keep you nil per mouth, okay, until you reach there, okay, and then they'll be looking after you, okay. And yes, Mr. Abdullah, you need not to be worried. I'll continue to take care of you once you are recovered from this, okay, and I wish you a speedy recovery, okay. And here is a leaflet. It includes all the information regarding your condition, okay. You can read, okay, whenever you get time, okay. Is everything clear till now? All right, Mr. Abdullah, is there anything else you want to discuss, share with me? Okay, Mr. Abdullah, I wish you a speedy recovery and healthy life, and take care. Bye-bye.